EMDR, or eye movement desensitization and reprocessing, is a treatment that uses 8 phases to work through trauma-related memories. So what we do is reprocess that trauma. So in doing that, you can see it more logically and reasonably, and you don't react emotionally. We go through a list of however many traumas you've had over the years, and usually the ones that were the oldest chronologically are causing the most problems. For instance, abuse in the house, neglect, a parent with substance abuse issues, and when we get to those core issues, typically the depression and anxiety will tend to lift after you reprocess the previous trauma. That's also a big thing with substance abuse, is those past traumas. A lot of people are self-numbing with substance abuse. So if you deal with the trauma, then the substance abuse lifts. The different theories on EMDR, the eye movement desensitization and reprocessing, one of those is it's related to REM sleep. When you're sleeping and you're having rapid eye movement sleep, you're having dreams and images and emotions. One theory anyway is that while you're doing the eye movement, you sort of recreate that situation while you're awake, which allows you to imagine the memory, work through it, you feel the emotion and thoughts associated with it, and then you can take out some of the issues that cause the trauma and replace it with more positive or functional views of yourself and the world. I had a lot of special training in that. I was lucky to be one of 10 counselors in the area chosen to get into the EMDR training. I was trained by Dr. Ricky Greenwald. He's one of the top EMDR therapists around, and he came to Johnstown and did a training at, we did it at ACRP. But there was 10 of the top counselors in the area, and I was lucky enough to be chosen to be in that group. It lasted for about a year. We were recorded doing it. We had to get clients to sign up a release form, so they knew I was in training when I first did it. And then Dr. Greenwald would look at each of these videos and kind of pick through what we did right and what we did wrong. And then we'd have to go up in front of the class and sort of talk about what we did wrong sometimes, and how to fix it. So I'm very extensively trained. And then along with that, you have to get 12 hours every 2 years of continuing education just in EMDR to be able to be a certified provider. Some people have EMDR training, but they don't have the full certification, but I'm fully certified. So I've been doing it for a while. I use it pretty much every day at my office, and I see a lot of really good results. While it's not for everybody, some people it can be a little intense. So people that are into it are really into it, and it works very well. I've also had it done on me too. So to be an EMDR therapist, you have to have the therapy on you. So I've had it done on me, and I've noticed a lot of benefits just personally. Dr. Greenwald came to Johnstown and did a training for 10 counselors in the area. It's lasted around a year. We first came in for a 2-week basic training course where we learned the basics of EMDR. We learned how it works, why it works, what population to use it with. And after doing that, we did an 8-month period where we were doing consultations with very highly trained trauma clinicians that work all over the country, and we had these consultations with them. They taught us, what do we do, what don't we do, and when we would have problems in different situations with clients that were really having some difficult symptoms, they would help us through it. And as you learn to treat more difficult clients, then you get better at treating that thing. When we were finally certified and done, then we're on our own, and I feel confident that I can handle just about anything that walks through the door.